Medical Assistant Exam Study Guide. Question 1. After confirming the patient's identity, a patient drank hot coffee immediately before an oral temperature is planned. Which action should the medical assistant take? Option A. Use the same probe cover for a repeat reading. Option B. Ask the patient to sip cold water to balance the reading. Option C. Wait before taking the oral temperature or use an approved alternate route. Option D. Record the temperature immediately because coffee has no effect. The correct answer is option C. Wait before taking the oral temperature or use an approved alternate route. Hot or cold intake can temporarily alter oral temperature readings, so waiting or using an approved alternate route improves accuracy. Immediate measurement, reused covers, or trying to offset the effect with another drink can create unreliable data and poor infection control. Question 2. Before documenting in the chart, height and weight have been obtained during an annual physical during a high-yield exam review. What does BMI help screen for? Option A. Weight status in relation to height. Option B. Visual acuity at distance. Option C. Kidney filtration rate. Option D. Blood oxygen level during exercise. The correct answer is option A. Weight status in relation to height. BMI estimates weight status by comparing weight with height and is used as a screening tool rather than a diagnosis by itself. Oxygen saturation, kidney filtration, and vision screening require different measurements and equipment. Question 3. A medical assistant reviews a case where an adult patient is asked to rate pain during intake for an adult patient. Which documentation is most appropriate? Option A. Pain is bad because the patient looks uncomfortable. Option B. Patient probably exaggerates pain. Option C. No pain score needed because vital signs are normal. Option D. Pain level of 7 on a 0 to 10 scale with location and quality. The correct answer is option D. Pain level of 7 on a 0 to 10 scale with location and quality. Pain is subjective and should be documented using the patient's stated rating along with useful details such as location and quality. Judgments, assumptions, and ignoring pain because other vital signs are normal fail to capture the patient's report. Question 4. While following clinic policy, the medical assistant notes that a patient says, "I feel pressure in my chest after climbing stairs." How should the information be documented? Option A. Record the statement as subjective data in the patient's own words when possible. Option B. Document it as a confirmed diagnosis of angina. Option C. Change the wording to make it sound less serious. Option D. Leave it out unless the provider hears it directly. The correct answer is option A. Record the statement as subjective data in the patient's own words when possible. The patient's reported symptom is subjective data and should be documented accurately for the provider's evaluation. Medical assistants should not diagnose, omit relevant symptoms, or soften documentation in a way that changes the meaning. Question 5. A medical assistant reviews a case where a medication note refers to hypotension before the patient leaves the clinic. What does hypo mean? Option A. Before birth. Option B. Above normal. Option C. Below normal or low. Option D. Between ribs. The correct answer is option C. Below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 6. When preparing safe patient care, a blood specimen label is about to be placed on a tube for a returning patient. Which action best prevents patient identification errors? Option A. Ask another patient to confirm the name. Option B. Use the room number as the only identifier. Option C. Verify two identifiers such as full name and date of birth before labeling. Option D. Label the tube after returning to the desk. The correct answer is option C. Verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 7. In a medical assistant certification review scenario, a tympanic temperature is ordered for an adult patient. Which technique is appropriate? Option A. Use the same technique for every age without adjustment. Option B. Force the probe deeply into the ear canal. Option C. Position the ear canal according to device instructions before inserting the covered probe. Option D, use the probe without a cover to improve contact. The correct answer is option C. Position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 8. During a skills check, the scenario states that an adult patient has a respiratory rate of 18 breaths per minute at rest while prioritizing patient safety. How should this rate generally be interpreted? Option A. It proves the patient has asthma. Option B. It is within the usual adult resting range. Option C. It is always a medical emergency. Option D. It indicates apnea. The correct answer is option B. It is within the usual adult resting range. A resting adult respiratory rate of 18 per minute generally falls within the expected range. It does not indicate absence of breathing, does not automatically represent an emergency, and cannot diagnose asthma by itself. Question 9. When preparing safe patient care, a patient with shortness of breath is waiting to be evaluated for a patient who appears anxious. Which position may help breathing while waiting? Option A. Lithotomy position with feet in stirrups. Option B. Trendelenburg position with the head lowered. Option C. Fowler position with the head of the bed elevated. Option D. Prone position with the face down. The correct answer is option C. Fowler position with the head of the bed elevated. Fowler position can promote chest expansion and may ease breathing for many patients with dyspnea. Prone, Trendelenburg, and lithotomy positions are used for different purposes and can be inappropriate for shortness of breath. Question 10. For a patient with hypertension in an outpatient setting, a caller reports crushing chest pain and shortness of breath. Which response is appropriate? Option A. Follow emergency protocol and direct the caller to emergency services as instructed by policy. Option B. Schedule a routine visit next month. Option C. Diagnose indigestion over the phone. Option D. Tell the caller to drive alone to the clinic. The correct answer is option A. Follow emergency protocol and direct the caller to emergency services as instructed by policy. Chest pain with shortness of breath may be an emergency and should be managed using established protocols. Delaying care, advising unsafe transport, or diagnosing by phone is outside the medical assistant role. Question 11. While following clinic policy, the medical assistant notes that a used needle has just been removed from a syringe after an injection during a high-yield exam review. Which action is safest? Option A. Carry it uncovered to the front desk. Option B. Place the sharp immediately into an approved sharps container. Option C. Recap it using 2 hands before disposal. Option D. Drop it in a regular trash can. The correct answer is option B. Place the sharp immediately into an approved sharps container. Used sharps should go directly into a puncture-resistant sharps container to prevent injury and exposure. Carrying, recapping with 2 hands, or using regular trash creates avoidable needle stick risk. Question 12. At a new patient intake, an adult patient is involved when a patient is placed on contact precautions for a draining wound for an adult patient. Which PPE is typically expected when entering for direct care? Option A. Sterile gloves instead of all other PPE. Option B. No PPE because drainage is covered. Option C. Gloves and gown as indicated by the isolation signage. Option D. Only a surgical mask for every interaction. The correct answer is option C. Gloves and gown as indicated by the isolation signage. Contact precautions commonly require gloves and gown for direct contact with the patient or environment. A mask alone, no PPE, or sterile gloves without other indicated protection does not match the purpose of contact precautions. Question 13. During a skills check, the scenario states that a patient has symptoms consistent with influenza. Which PPE is commonly used for close contact? Option A. A lead apron. Option B. A surgical mask with standard precautions. Option C. No mask because influenza is not contagious. Option D. Only sterile shoe covers. The correct answer is option B. A surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 14. After confirming the patient's identity, an exam table is cleaned between patients after routine use while communicating with the care team. Which term describes reducing many pathogens on a surface? Option A, disinfection. Option B, apical measurement. Option C, transcription. Option D, venipuncture. The correct answer is option A, disinfection. Disinfection reduces many disease-causing organisms on surfaces and is appropriate for many non-critical items. Apical measurement, venipuncture, and transcription are unrelated clinical or administrative tasks. Question 15. A provider asks for assistance because an anatomy diagram divides the body into left and right portions for a patient who appears anxious. Which plane is shown? Option A, frontal plane. Option B, sagittal plane. Option C, oblique medication route. Option D, transverse plane. The correct answer is option B, sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back, and oblique medication route is not an anatomical plane. Question 16. After confirming the patient's identity, smoke is seen near an electrical outlet in the clinic. Which action aligns with the race fire response sequence? Option A, collect insurance cards before leaving. Option B, open all doors to ventilate smoke. Option C, ignore the smoke until flames appear. Option D, rescue patients in immediate danger and activate the alarm according to policy. The correct answer is option D, rescue patients in immediate danger and activate the alarm according to policy. RACE emphasizes rescuing those in danger, activating alarm, containing fire, and extinguishing or evacuating as appropriate. Administrative tasks, opening doors, or ignoring smoke can worsen danger and delay response. Question 17. A provider asks for assistance because a box of supplies must be lifted from the floor after reviewing the order. Which technique helps prevent injury? Option A, lock the knees and lift with the back. Option B, hold the box far away from the body. Option C, bend at the knees and keep the load close to the body. Option D, twist at the waist while lifting. The correct answer is option C, bend at the knees and keep the load close to the body. Using the legs and keeping the load close reduces strain on the back. Twisting, holding weight away, and lifting with locked knees increase risk of musculoskeletal injury. Question 18. A provider asks for assistance because a small blood spill occurs on an exam room floor for a teen patient. Which action should be included? Option A, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Option B, clean it with a dry tissue only. Option C, cover it with paper and leave it for housekeeping tomorrow. Option D, ask a visitor to wipe it up. The correct answer is option A, wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 19. After confirming the patient's identity, an employee is assigned to duties with potential blood exposure. Which training is required by safety standards? Option A, real estate licensing training. Option B, restaurant menu training. Option C, retail cashier training only. Option D, bloodborne pathogen training with exposure control procedures. The correct answer is option D, bloodborne pathogen training with exposure control procedures. Bloodborne pathogen training teaches exposure risks, protective practices, and post-exposure steps for healthcare workers. The other trainings do not address occupational exposure to blood or body fluids. Question 20. While following clinic policy, the medical assistant notes that a patient performs a pulmonary function test during the visit. Which instruction helps obtain a useful result? Option A, breathe around the mouthpiece. Option B, stop as soon as mild effort begins. Option C, seal lips around the mouthpiece and follow coaching for a full effort. Option D, chew gum during the test. The correct answer is option C, seal lips around the mouthpiece and follow coaching for a full effort. Spirometry requires a tight seal and strong coached effort for reliable measurements. Leaking air, early stopping, or chewing interferes with test accuracy. Question 21. When preparing safe patient care, a complete blood count is ordered for a patient for an adult patient. Which tube is most appropriate? Option A, lavender EDTA tube. Option B, plain urine cup. Option C, light blue citrate tube. Option D, gray fluoride tube. The correct answer is option A, lavender EDTA tube. Lavender tubes contain EDTA, which preserves blood cells for hematology testing such as a complete blood count. Citrate, fluoride, and urine containers do not provide the correct specimen type for a CBC. Question 22. While following clinic policy, the medical assistant notes that a chemistry test requires serum rather than whole blood. Which specimen type is needed? Option A, a finger stick smear without clotting. Option B, blood mixed continuously with EDTA. Option C, blood allowed to clot before serum is separated. Option D, a throat swab placed in urine preservative. The correct answer is option C, blood allowed to clot before serum is separated. Serum is the liquid portion obtained after blood clots and is separated from the clot. EDTA whole blood, incorrect swab handling, and an unprocessed finger stick smear do not provide serum. Question 23. During a skills check, the scenario states that venipuncture is being performed in the antecubital area while following standard precautions. Which insertion technique is generally appropriate? Option A, insert parallel under the skin for several inches. Option B, insert bevel down at a 90-degree angle. Option C, insert the needle bevel up at about a 15 to 30-degree angle. Option D, insert through the vein and redirect repeatedly. The correct answer is option C, insert the needle bevel up at about a 15 to 30-degree angle. A bevel up 15 to 30-degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 24. At a pediatric visit, a patient with limited mobility is involved when a blood specimen arrives hemolyzed after collection for a patient with limited mobility. Which practice helps prevent this problem? Option A, force blood through a small needle into the tube. Option B, gently invert tubes according to additive requirements. Option C, use excessive suction on fragile veins. Option D, shake tubes vigorously to mix faster. The correct answer is option B, gently invert tubes according to additive requirements. Gentle inversion mixes additives without damaging red blood cells. Vigorous shaking, excessive suction, and forcing blood through narrow equipment can rupture cells and cause hemolysis. Question 25. A medical assistant reviews a case where a patient is pale, cool, clammy, and confused after an injury. Which condition is a concern? Option A, acne. Option B, shock. Option C, glotitis externa. Option D, myopia. The correct answer is option B, shock. Pale cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 26. A medical assistant reviews a case where a urine culture is ordered for a patient with possible infection while supporting safe patient care. Which instruction is appropriate? Option A, collect from the toilet bowl after voiding. Option B, clean the area and collect a midstream specimen in the sterile container. Option C, touch the inside of the lid to keep it nearby. Option D, fill the container with water before collecting urine. The correct answer is option B, clean the area and collect a midstream specimen in the sterile container. A clean catch midstream technique reduces contamination for culture results. Touching sterile surfaces, collecting from the toilet, or adding water can contaminate or dilute the specimen. Question 27. For a new patient in an outpatient setting, a point-of-care test control result is outside the acceptable range for a new patient. Which action should occur before testing patients? Option A, change patient results to match expectations. Option B, do not report patient results until the control problem is resolved. Option C, to throw away the control log. Option D, continue testing because controls are optional. The correct answer is option B, do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 28. When preparing safe patient care, a urine specimen cannot be tested promptly. Which action preserves specimen quality according to policy? Option A, mix it with another patient's specimen. Option B, refrigerate or preserve it if testing is delayed beyond the allowed time. Option C, place it near a sunny window to keep warm. Option D, leave it uncapped at room temperature all day. The correct answer is option B, refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 29. When preparing safe patient care, a finger stick specimen is being collected while preventing documentation errors. Which step is commonly performed after puncture? Option A, wipe away the first drop of blood if required by the test procedure. Option B, bandage before collecting the specimen. Option C, squeeze the finger forcefully until tissue fluid appears. Option D, touch the collection device to the skin surface repeatedly. The correct answer is option A, wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 30. In a medical assistant certification review scenario, ear irrigation is ordered for cerumen removal for a patient with limited mobility. Which precaution is important? Option A, aim forcefully at the eardrum. Option B, proceed even if the patient reports severe ear pain. Option C, verify the order and screen for contraindications such as ear pain or perforation history. Option D, use very hot water to dissolve wax quickly. The correct answer is option C, verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 31. In a medical assistant certification review scenario, blood cultures are being collected. Which step is especially important? Option A, skip antisepsis because culture bottles contain additives. Option B, draw through visibly dirty skin. Option C, palpate the site again with an unclean glove after cleaning. Option D, use proper skin antisepsis and avoid contaminating the cleaned site. The correct answer is option D, use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 32. A provider asks for assistance because a labeled blood specimen is being sent to the laboratory during the visit. Which packaging is appropriate? Option A, put it loose in the regular mail bin. Option B, place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Option C, tape it to the outside of the requisition. Option D, carry it open in a coat pocket. The correct answer is option B. Place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Biohazard transport bags help contain leaks and keep paperwork protected from contamination. Pockets, taped tubes, and loose mail bin transport create exposure and specimen handling risks. Question 33. While following clinic policy, the medical assistant notes that a 12-lead EKG is being set up for a patient asking for clarification. Where is lead V1 placed? Option A, on the right wrist beside the limb lead. Option B, fourth intercostal space at the right sternal border. Option C, fifth intercostal space at the left anterior axillary line. Option D, second intercostal space at the left midclavicular line. The correct answer is option B, fourth intercostal space at the right sternal border. V1 is placed at the fourth intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 34. For a patient asking for clarification in an outpatient setting, a medical assistant is locating the V4 chest lead. Which landmark is correct? Option A, fourth intercostal space at the right sternal border. Option B, left wrist below the thumb. Option C, fifth intercostal space at the left midclavicular line. Option D, second rib at the right axillary line. The correct answer is option C, fifth intercostal space at the left midclavicular line. V4 is placed in the fifth intercostal space at the left midclavicular line. The other choices describe V1, a limb lead area, or an incorrect thoracic location. Question 35. While following clinic policy, the medical assistant notes that multiple tubes including blood cultures are ordered during venipuncture while preparing for provider review. Which specimen is collected first in the standard order of draw? Option A, lavender EDTA tube. Option B, blood cultures. Option C, gray fluoride tube. Option D, red serum tube after all additives. The correct answer is option B, blood cultures. Blood cultures are collected first to reduce contamination risk before additive tubes are drawn. Drawing EDTA, fluoride, or later serum tubes first can interfere with the proper sequence and specimen integrity. Question 36. For an adult patient in an outpatient setting, a patient is going home with a Holter monitor for an adult patient. Which instruction is important? Option A. Take a shower with the monitor unless told otherwise. Option B. Avoid writing down chest discomfort. Option C. Keep a diary of symptoms and activities during monitoring. Option D. Remove the electrodes whenever symptoms occur. The correct answer is option C. Keep a diary of symptoms and activities during monitoring. A symptom and activity diary helps correlate patient experiences with recorded heart rhythm data. Removing electrodes, getting the device weighed against instructions, or failing to note symptoms reduces the usefulness of the test. Question 37. While following clinic policy, the medical assistant notes that a regular EKG rhythm has 4 large boxes between our waves. Which approximate heart rate is calculated using the 300 method? Option A, 75 beats per minute. Option B, 40 beats per minute. Option C, 120 beats per minute. Option D, 300 beats per minute. The correct answer is option A, 75 beats per minute. For a regular rhythm, dividing 300 by the number of large boxes gives an estimate, so 300 divided by 4 equals 75. The other values do not match the 300 method for 4 large boxes. Question 38. When preparing safe patient care, a 12-lead EKG requires limb electrodes while communicating with the care team. Which label belongs on the right arm area? Option A, LL. Option B, LA. Option C, RA. Option D, V4. The correct answer is option C, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 39. During a skills check, the scenario states that the EKG pattern looks unusual and limb lead placement may have been reversed for a teen patient. Which action is appropriate? Option A, change the printed rhythm interpretation manually. Option B, check lead placement before repeating or submitting the tracing. Option C, remove the patient's identification label. Option D, submit it without comment because lead placement never matters. The correct answer is option B, check lead placement before repeating or submitting the tracing. Incorrect lead placement can produce misleading tracings, so verifying lead location is part of quality practice. Submitting without checking, removing identification, or altering interpretation manually is unsafe. Question 40. During a skills check, the scenario states that blood cultures are being collected. Which step is especially important? Option A, skip antisepsis because culture bottles contain additives. Option B, draw through visibly dirty skin. Option C, palpate the site again with an unclean glove after cleaning. Option D, use proper skin antisepsis and avoid contaminating the cleaned site. The correct answer is option D, use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 41. In a medical assistant certification review scenario, a patient is scheduled for an antibiotic injection during a realistic certification question. Which step is essential before administration? Option A, assume no allergy if the patient is young. Option B, give half the dose without checking. Option C, ask only whether the patient likes injections. Option D, ask about allergies and check the record for documented reactions. The correct answer is option D, Ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 42. In a medical assistant certification review scenario, a medication is ordered by the subcutaneous route for a patient with hypertension. Where is the medication intended to be placed? Option A, into the fatty tissue beneath the skin. Option B, into the outer layer of bone. Option C, into the spinal canal. Option D, directly into a vein. The correct answer is option A, into the fatty tissue beneath the skin. Subcutaneous injections deliver medication into the tissue layer beneath the skin and above muscle. Intravenous, bone, and spinal routes are different procedures with different risks and training requirements. Question 43. During a morning clinic session, a patient asking for clarification is involved when a patient brings several prescription bottles to a visit. What is the purpose of medication reconciliation? Option A, record only medications purchased at the clinic. Option B, compare all current medications to identify omissions, duplications, or interactions. Option C, throw away medications that look old without asking. Option D, replace the provider's medication review. The correct answer is option B, compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 44. In a medical assistant certification review scenario, a patient says they cannot swallow tablets safely after noticing a potential safety concern. Which action is appropriate before giving an oral medication? Option A, tell the patient to swallow it dry. Option B, hide the tablet in food without consent. Option C, crush every tablet automatically. Option D, notify the provider and follow instructions before altering the medication. The correct answer is option D, notify the provider and follow instructions before altering the medication. Some tablets should not be crushed or altered, so the provider or pharmacist guidance is needed. Automatic crushing, dry swallowing, or hiding medication can create safety and consent problems. Question 45. While preparing the exam room, height and weight have been obtained during an annual physical for a patient who appears anxious. What does BMI help screen for? Option A, kidney filtration rate. Option B, weight status in relation to height. Option C, blood oxygen level during exercise. Option D, visual acuity at distance. The correct answer is option B, weight status in relation to height. BMI estimates weight status by comparing weight with height and is used as a screening tool rather than a diagnosis by itself. Oxygen saturation, kidney filtration, and vision screening require different measurements and equipment. Question 46. In a medical assistant certification review scenario, a patient uses an albuterol inhaler for wheezing. What is the intended effect? Option A, increase blood clotting. Option B, destroy bacteria in the stomach. Option C, lower cholesterol over months. Option D, relax airway smooth muscle to improve airflow. The correct answer is option D, relax airway smooth muscle to improve airflow. Albuterol is a bronchodilator that opens airways and can relieve bronchospasm. Blood clotting, cholesterol control, and bacterial destruction are unrelated medication effects. Question 47. When preparing safe patient care, a controlled medication is stored in the clinic while preventing documentation errors. Which practice supports accountability? Option A, document receipt, administration, waste, and remaining count according to policy. Option B, keep it unlocked for convenience. Option C, estimate the count once a year. Option D, let patients sign it out themselves. The correct answer is option A, document receipt, administration, waste, and remaining count according to policy. Controlled substances require strict documentation and secure handling to prevent diversion and errors. Unlocked storage, infrequent estimates, or patient self-checkout would break accountability requirements. Question 48. When preparing safe patient care, a patient takes several products for cold symptoms and pain for a patient with a routine complaint. Which concern should be reviewed with acetaminophen? Option A, It replaces all vaccines. Option B, accidental duplicate dosing can increase liver injury risk. Option C, it always causes bacterial resistance. Option D, it should be taken only by injection. The correct answer is option B. Accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 49. A provider asks for assistance because a patient uses a medication patch. Which instruction is important when applying a new patch? Option A, cover the patch with a heating pad. Option B, cut all patches to adjust the dose. Option C, remove the old patch before applying the new one if directed. Option D, apply every patch in the same irritated spot. The correct answer is option C. Remove the old patch before applying the new one if directed. Removing the old patch prevents unintended extra dosing when the medication is delivered through the skin. Irritated sites, cutting patches, or adding heat may change absorption and increase adverse effects. Question 50. A provider asks for assistance because ear irrigation is ordered for cerumen removal while preparing for provider review. Which precaution is important? Option A, verify the order and screen for contraindications such as ear pain or perforation history. Option B, aim forcefully at the eardrum. Option C, proceed even if the patient reports severe ear pain. Option D, use very hot water to dissolve wax quickly. The correct answer is option A. Verify the order and screen for contraindications such as ear pain or perforation history. Ear irrigation requires appropriate order, temperature, and screening because perforation or infection can make irrigation unsafe. Hot water, forceful aiming, or ignoring pain can injure the patient. Question 51. For an older adult in an outpatient setting, a term contains the combining form cardi/o for an older adult. Which body structure is referenced? Option A, kidney. Option B, heart. Option C, stomach. Option D, skin. The correct answer is option B, heart. Cardi/o refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 52. While assisting with patient care, a patient asking for clarification is involved when a pulse rate is documented as tachycardic. Which finding is being described? Option A, inflammation of the stomach. Option B, low body temperature. Option C, slow breathing only. Option D, faster than normal heart rate. The correct answer is option D, faster than normal heart rate. Tachycardia describes an abnormally fast heart rate for the patient's situation. Low temperature, slow respirations, and stomach inflammation are different concepts. Question 53. During a skills check, the scenario states that a diabetic patient is shaky, sweating, and confused before lunch during a realistic certification question. Which condition should be considered? Option A, hyperopia. Option B, hypoglycemia. Option C, dermatitis only. Option D, otitis media. The correct answer is option B, hypoglycemia. Shaking, sweating, and confusion can occur with low blood glucose, especially when meals are delayed. Vision farsightedness, middle ear infection, and skin inflammation do not best match this symptom pattern. Question 54. While preparing the exam room, a patient with COPD reports increased shortness of breath for a new patient. Which system is primarily involved? Option A, integumentary system only. Option B, skeletal system only. Option C, respiratory system. Option D, reproductive system only. The correct answer is option C, respiratory system. COPD is a chronic respiratory condition involving airflow limitation. Skin, reproductive, and skeletal systems may matter in healthcare but are not the primary system in COPD. Question 55. In a medical assistant certification review scenario, a blood pressure reading is being prepared for an adult with a large upper arm. Which action supports the most accurate result? Option A, select a cuff with a bladder size appropriate for the arm circumference. Option B, deflate the cuff as rapidly as possible. Option C, use the smallest cuff to keep it snug. Option D, place the cuff over the sleeve for comfort. The correct answer is option A, select a cuff with a bladder size appropriate for the arm circumference. Correct cuff size keeps the pressure reading closer to the patient's true blood pressure because an undersized cuff can falsely elevate the value. Measuring over clothing, choosing equipment for convenience, or deflating too quickly can distort the reading and lead to poor clinical decisions. Question 56. When preparing safe patient care, a study question asks about bile production after the patient asks a follow-up question. Which organ is primarily responsible? Option A, bladder. Option B, liver. Option C, the appendix. Option D, the adrenal gland. The correct answer is option B, liver. The liver produces bile, which helps with fat digestion after storage and release through the biliary system. The appendix, bladder, and adrenal gland have different roles. Question 57. While rooming a patient, a medication note refers to hypotension for a patient in the exam room. What does hypo mean? Option A, above normal. Option B, before birth. Option C, below normal or low. Option D, between ribs. The correct answer is option C, below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 58. During a skills check, the scenario states that a patient describes dysuria. What does dys usually indicate? Option A, normal. Option B, after meals. Option C, without. Option D, difficult or painful. The correct answer is option D, difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 59. A provider asks for assistance because a wound is described as lateral to the umbilicus while following standard precautions. What does lateral mean? Option A, away from the midline. Option B, toward the head. Option C, toward the midline. Option D, closer to the point of attachment. The correct answer is option A, away from the midline. Lateral means farther from the body's midline. Medial, superior, and proximal describe toward the midline, toward the head, and closer to an attachment point. Question 60. Before documenting in the chart, a finger stick specimen is being collected for a teen patient. Which step is commonly performed after puncture? Option A, squeeze the finger forcefully until tissue fluid appears. Option B, touch the collection device to the skin surface repeatedly. Option C, bandage before collecting the specimen. Option D, wipe away the first drop of blood if required by the test procedure. The correct answer is option D, wipe away the first drop of blood if required by the test procedure. Many capillary procedures call for wiping the first drop because it may contain tissue fluid or contaminants. Excessive squeezing, scraping the skin, or bandaging before collection can compromise the specimen. Question 61. During a skills check, the scenario states that a patient is lying face down on the exam table. Which term describes this position? Option A, prone. Option B, supine. Option C, Trendelenburg. Option D, Fowler. The correct answer is option A, prone. Prone means lying face down. Supine is face up. Fowler is seated with the head elevated, and Trendelenburg positions the head lower than the feet. Question 62. In an outpatient medical office, a patient scheduled for a procedure is involved when a patient has fatigue, cold intolerance, and weight gain with low thyroid activity while checking the chart. Which condition is suggested? Option A, hyperventilation. Option B, otitis media. Option C, hypothyroidism. Option D, tachycardia only. The correct answer is option C, hypothyroidism. Hypothyroidism reflects reduced thyroid hormone activity and can slow metabolism. Hyperventilation, middle ear infection, and fast heart rate do not match the low thyroid pattern described. Question 63. During a follow-up visit, a patient has swelling in the ankles from excess fluid in tissues for a new patient. Which term applies? Option A, hematuria. Option B, cyanosis. Option C, diplopia. Option D, edema. The correct answer is option D, edema. Edema is swelling caused by fluid accumulation in tissues. Cyanosis, hematuria, and diplopia refer to bluish discoloration, blood in urine, and double vision. Question 64. When preparing safe patient care, a caller reports crushing chest pain and shortness of breath. Which response is appropriate? Option A, follow emergency protocol and direct the caller to emergency services as instructed by policy. Option B, schedule a routine visit next month. Option C, tell the caller to drive alone to the clinic. Option D, diagnose indigestion over the phone. The correct answer is option A. Follow emergency protocol and direct the caller to emergency services as instructed by policy. Chest pain with shortness of breath may be an emergency and should be managed using established protocols. Delaying care, advising unsafe transport, or diagnosing by phone is outside the medical assistant role. Question 65. During a skills check, the scenario states that a patient takes several products for cold symptoms and pain after the patient asks a follow-up question. Which concern should be reviewed with acetaminophen? Option A, accidental duplicate dosing can increase liver injury risk. Option B, it replaces all vaccines. Option C, it always causes bacterial resistance. Option D, it should be taken only by injection. The correct answer is option A. Accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 66. A medical assistant reviews a case where a patient pays a fixed amount at each office visit under the insurance plan for a pediatric patient. Which term describes this payment? Option A, premium refund. Option B, deductible only. Option C, copayment. Option D, relative value unit. The correct answer is option C, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 67. During a skills check, the scenario states that an insurance plan pays 80% and the patient is responsible for 20% after the deductible. Which term describes the patient portion? Option A, chief complaint. Option B, sterilization. Option C, coinsurance. Option D, capitation only. The correct answer is option C, coinsurance. Coinsurance is a percentage share of allowed costs paid by the patient. Chief complaint, capitation, and sterilization describe different clinical or payment concepts. Question 68. In a medical assistant certification review scenario, a claim needs a code for an office procedure performed by the provider while preventing documentation errors. Which code set is commonly used? Option A, CPT. Option B, ICD-10-CM. Option C, alphabetic filing. Option D, advanced directive. The correct answer is option A, CPT. CPT codes describe medical procedures and services for billing. ICD-10-CM diagnoses, filing systems, and advanced directives do not code the service performed. Question 69. Before documenting in the chart, a medical office submits a professional paper claim for a patient waiting for the provider. Which form is traditionally used? Option A, CMS 1500. Option B, growth chart. Option C, fire extinguisher tag. Option D, W-4 tax withholding form. The correct answer is option A, CMS 1500. The CMS 1500 is the standard paper professional claim form. Tax, safety, and growth documents are unrelated to claim submission. Question 70. During a skills check, the scenario states that a patient's insurance requires approval to see a specialist. Which document or process may be needed? Option A, autoclave log only. Option B, referral. Option C, medication lot sticker. Option D, inventory count sheet. The correct answer is option B, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits. Question 71. When preparing safe patient care, a patient wants lab results through an online system before documentation is completed. Which feature supports secure access? Option A, a patient portal with identity verification and secure messaging. Option B, a hallway bulletin board. Option C, a group text to unrelated patients. Option D, a public social media comment. The correct answer is option A, a patient portal with identity verification and secure messaging. A patient portal is designed to give patients secure access to health information and communication. Social posts, bulletin boards, and unrelated group texts expose protected information. Question 72. While following clinic policy, the medical assistant notes that the provider blocks lunch, meetings, and procedure times before booking patients for a patient asking for clarification. Which scheduling method is being used? Option A, matrix scheduling. Option B, biohazard scheduling. Option C, sterile scheduling only. Option D, or random scheduling. The correct answer is option A, matrix scheduling. Matrix scheduling blocks unavailable or reserved times so appointments are not placed there. Random, biohazard, and sterile scheduling are not standard appointment scheduling methods. Question 73. For a pediatric patient in an outpatient setting, 2 patients are placed in the same appointment slot. What is this called? Option A, downcoding only. Option B, double booking. Option C, capillary puncture. Option D, closed filing. The correct answer is option B, double booking. Double booking schedules more than one patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 74. A provider asks for assistance because medical supplies have expiration dates while working under provider supervision. Which inventory method reduces waste? Option A, use first in, first out rotation while checking expiration dates. Option B, use the newest supplies first every time. Option C, hide older supplies behind new boxes. Option D, ignore expiration dates if packaging looks clean. The correct answer is option A, use first in, first out rotation while checking expiration dates. First in, first out rotation helps older usable supplies get used before they expire. Newest first storage, hiding older stock, or ignoring dates increases waste and safety risk. Question 75. During a skills check, the scenario states that a container holds blood-contaminated disposable materials for a patient with limited mobility. Which label or container is appropriate? Option A, a food storage bag. Option B, an unlabeled cardboard box. Option C, a biohazard-marked container according to facility policy. Option D, a plain office recycling bin. The correct answer is option C, a biohazard-marked container according to facility policy. Blood-contaminated waste requires proper biohazard labeling and disposal to protect staff and waste handlers. Office recycling, food bags, and unlabeled boxes do not communicate exposure risk or meet safe handling expectations. Question 76. When preparing safe patient care, a patient asks the medical assistant to diagnose a rash. Which response is appropriate? Option A, prescribe a topical steroid. Option B, explain that the provider will evaluate the rash and document the patient's concern. Option C, tell the patient no evaluation is needed. Option D, diagnose the rash as cancer. The correct answer is option B, explain that the provider will evaluate the rash and document the patient's concern. Medical assistants collect information and assist with care but do not diagnose or prescribe. Giving a diagnosis, ordering treatment independently, or dismissing the concern exceeds appropriate scope. Question 77. In a medical assistant certification review scenario, a competent adult refuses a recommended injection during the visit. Which action is appropriate? Option A, notify the provider and document the refusal according to policy. Option B, force the injection because it was ordered. Option C, hide the syringe in another medication. Option D, delete the order without telling anyone. The correct answer is option A, notify the provider and document the refusal according to policy. Competent patients generally have the right to refuse care, and the refusal should be communicated and documented. Force, deception, or unauthorized deletion violates autonomy and safe practice. Question 78. For a patient asking for clarification in an outpatient setting, a staff member fails to follow a safety policy and a patient is injured as a result for a patient asking for clarification. Which concept is involved? Option A, therapeutic communication only. Option B, autoclaving. Option C, coinsurance. Option D, negligence. The correct answer is option D, negligence. Negligence involves a breach of duty that contributes to harm. sterilization, cost sharing, and communication skills are different concepts and do not describe the legal breach by themselves. Question 79. When preparing safe patient care, a staff member needs to discuss lab results with a patient. Which location best protects confidentiality? Option A. A private area away from other patients. Option B. The crowded waiting room. Option C. The clinic's social media page. Option D. A public elevator. The correct answer is option A. A private area away from other patients. Private conversations protect the patient's health information from unnecessary disclosure. Waiting rooms, elevators, and social media are inappropriate places to discuss confidential results. Question 80. While following clinic policy, the medical assistant notes that several patients are scheduled at the beginning of the hour and seen in order of arrival or need after reviewing the order. Which system is this? Option A. Wave scheduling. Option B. Pulse deficit scheduling. Option C. Sterilization cycle. Option D. Double entry bookkeeping. The correct answer is option A. Wave scheduling. Wave scheduling brings multiple patients in during a time block to manage provider flow. Bookkeeping, sterilization, and pulse comparison are unrelated concepts. Question 81. When preparing safe patient care, a patient receives new wound care instructions for an adult patient. Which method checks understanding? Option A. Give instructions as quickly as possible and leave. Option B. Ask only whether the patient owns a phone. Option C. Ask the patient to explain the steps in their own words. Option D. Assume silence means full understanding. The correct answer is option C. Ask the patient to explain the steps in their own words. Teach back confirms understanding by having the patient describe the instructions. Phone ownership, rushed teaching, and silence do not verify that the patient can follow the plan. Question 82. After confirming the patient's identity, a medical assistant wants to learn more about a symptom timeline. Which prompt encourages a fuller answer? Option A. You are fine now, correct? Option B. Do not talk about the symptom. Option C. It started yesterday, right? Option D. Tell me when you first noticed the symptom and how it has changed. The correct answer is option D. Tell me when you first noticed the symptom and how it has changed. Open-ended prompts let the patient provide a narrative and timeline in their own words. Leading or dismissive statements restrict the information and can bias the history. Question 83. After confirming the patient's identity, a patient with limited English proficiency needs discharge teaching while preventing documentation errors. Which approach is best? Option A. Skip teaching because interpretation takes time. Option B. Speak louder in English only. Option C. Use a qualified medical interpreter according to policy. Option D. Ask a young child to interpret sensitive information. The correct answer is option C. Use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 84. A medical assistant reviews a case where a patient offers an expensive gift in exchange for special treatment for a patient with a routine complaint. Which response is appropriate? Option A. Promise special access for more gifts. Option B. Post the gift online with patient details. Option C. Follow office policy and maintain professional boundaries. Option D. Accept the gift and move the patient ahead of others. The correct answer is option C. Follow office policy and maintain professional boundaries. Professional boundaries protect fairness, trust, and ethical care. Accepting gifts for special treatment, promising favors, or posting patient details creates ethical and privacy problems. Question 85. A provider asks for assistance because height and weight have been obtained during an annual physical. What does BMI help screen for? Option A. Visual acuity at distance. Option B. Weight status in relation to height. Option C. Blood oxygen level during exercise. Option D. Kidney filtration rate. The correct answer is option B. Weight status in relation to height. BMI estimates weight status by comparing weight with height and is used as a screening tool rather than a diagnosis by itself. Oxygen saturation, kidney filtration, and vision screening require different measurements and equipment. Question 86. While following clinic policy, the medical assistant notes that a patient chooses between treatment options after receiving information after confirming office policy. Which ethical principle is being respected? Option A, sterility. Option B, coinsurance. Option C, autonomy. Option D, artifact. The correct answer is option C, autonomy. Autonomy supports the patient's right to make informed decisions about care. Sterility, coinsurance, and artifact refer to infection control, insurance, and test quality issues. Question 87. When preparing safe patient care, an unconscious patient needs emergency care and no surrogate is available for an adult patient. Which consent concept may apply? Option A, alphabetic consent. Option B, routine copayment consent. Option C, express written refusal. Option D, implied consent. The correct answer is option D, implied consent. Implied consent may apply in emergencies when a patient cannot consent and urgent care is necessary. Written refusal, payment consent, and alphabetic consent do not describe this emergency concept. Question 88. Before documenting in the chart, a teen patient is involved when a patient in the waiting room reports crushing chest pain and sweating. Which action should the medical assistant take? Option A, offer billing forms before alerting anyone. Option B, activate the office emergency protocol and notify the provider immediately. Option C, tell the patient to drive home and sleep. Option D, ask the patient to wait until the next available routine slot. The correct answer is option B, activate the office emergency protocol and notify the provider immediately. Crushing chest pain with sweating may indicate a medical emergency and requires immediate escalation. Waiting, advising the patient to drive, or focusing on paperwork delays care. Question 89. After confirming the patient's identity, a patient begins having a seizure in the exam room after noticing a potential safety concern. Which action is appropriate? Option A, hold the patient down forcefully. Option B, put fingers in the patient's mouth. Option C, offer food during the seizure. Option D, protect the patient from injury and do not restrain movements. The correct answer is option D, protect the patient from injury and do not restrain movements. Seizure first aid focuses on safety, protecting the head, and allowing the seizure to pass without restraint. Placing objects in the mouth, forceful restraint, or giving food during a seizure can injure the patient. Question 90. While following clinic policy, the medical assistant notes that venipuncture is being performed in the antecubital area for an adult patient. Which insertion technique is generally appropriate? Option A, insert through the vein and redirect repeatedly. Option B, insert parallel under the skin for several inches. Option C, insert the needle bevel up at about a 15 to 30 degree angle. Option D, insert bevel down at a 90-degree angle. The correct answer is option C, insert the needle bevel up at about a 15 to 30 degree angle. A bevel up 15 to 30 degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 91. While following clinic policy, the medical assistant notes that a patient has a minor thermal burn from touching hot equipment. Which first aid action is appropriate? Option A, break blisters to release fluid. Option B, apply ice directly for a long time. Option C, cool the area with cool running water according to protocol. Option D, rub butter into the burn. The correct answer is option C, cool the area with cool running water according to protocol. Cooling a minor burn with cool running water can limit tissue damage and reduce pain. Direct prolonged ice, butter, or breaking blisters can damage tissue or increase infection risk. Question 92. In a medical assistant certification review scenario, a patient suddenly has facial drooping and arm weakness before the patient leaves the clinic. Which emergency condition should be suspected? Option A, simple paperwork fatigue. Option B, routine nearsightedness. Option C, seasonal allergies only. Option D, stroke. The correct answer is option D, stroke. Facial drooping and arm weakness are warning signs captured by FAST for possible stroke. Allergies, vision issues, and paperwork fatigue do not match sudden focal neurologic deficits. Question 93. Before documenting in the chart, adult CPR is started according to current basic life support guidance for an adult patient. Which compression rate is commonly taught? Option A, 250 to 300 compressions per minute. Option B, 100 to 120 compressions per minute. Option C, 10 to 20 compressions per minute. Option D, 1 compression every 5 minutes. The correct answer is option B, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 94. In a medical assistant certification review scenario, a conscious adult cannot speak or cough effectively while choking. Which first aid action is commonly used? Option A, offer a large meal. Option B, abdominal thrusts according to training. Option C, tell the patient to lie flat and sleep. Option D, insert a blind finger sweep. The correct answer is option B, abdominal thrusts according to training. Severe airway obstruction in a conscious adult is commonly treated with abdominal thrusts by trained responders. Food, lying down, or blind finger sweeps can worsen obstruction or injury. Question 95. While following clinic policy, the medical assistant notes that a tympanic temperature is ordered for an adult patient after noticing a potential safety concern. Which technique is appropriate? Option A, use the probe without a cover to improve contact. Option B, use the same technique for every age without adjustment. Option C, force the probe deeply into the ear canal. Option D, position the ear canal according to device instructions before inserting the covered probe. The correct answer is option D, position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 96. In a medical assistant certification review scenario, a patient is scheduled for a minor office procedure for a patient asking for clarification. Which role may the medical assistant perform? Option A, explain all surgical risks independently. Option B, witness the patient's signature after the provider obtains consent if office policy allows. Option C, perform the procedure without provider involvement. Option D, sign the consent for the patient. The correct answer is option B, witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role. Question 97. During a walk-in visit, a new patient is involved when a provider asks the medical assistant to prepare for suture removal. Which supply is commonly needed? Option A, a urine culture cup only. Option B, a blood pressure cuff only. Option C, a meal tray. Option D, sterile suture removal scissors or a sterile blade with forceps according to policy. The correct answer is option D, sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely. Question 98. When preparing safe patient care, a patient has a small foreign material exposure in the eye while maintaining privacy. Which action is appropriate before irrigation? Option A, apply random medication drops without order. Option B, use a dry cotton swab across the cornea. Option C, check the order or protocol and use appropriate solution and protection. Option D, ignore contact lenses and begin forcefully. The correct answer is option C, check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 99. For a patient waiting for the provider in an outpatient setting, a patient is using a nebulizer treatment in the office for a patient waiting for the provider. Which instruction is appropriate? Option A, drink the medication from the cup. Option B, breathe normally through the mouthpiece or mask as directed until treatment is complete. Option C, share the mouthpiece with another patient. Option D, turn the machine off whenever mist appears. The correct answer is option B, breathe normally through the mouthpiece or mask as directed until treatment is complete. Nebulizers convert medication into mist for inhalation, so breathing through the device as directed is needed. Drinking medication, stopping at the start, or sharing equipment is unsafe and ineffective. Question 100. After confirming the patient's identity, a patient is scheduled for a minor office procedure. Which role may the medical assistant perform? Option A. Witness the patient's signature after the provider obtains consent if office policy allows. Option B. Explain all surgical risks independently. Option C. Perform the procedure without provider involvement. Option D. Sign the consent for the patient. The correct answer is option A. Witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role.